Okay, this is part 2 of I Will Give You Back Your Health Again by Dr. Day. It's all about how to improve health. She's a lady who survived metastatic breast cancer by becoming a low-fat vegan and lived like another, 40-something years. Okay, she says the cancer statistics are deliberately manipulated by eliminating all lung cancer patients who have a very high mortality rate and by removing all black people with cancer from the statistics because black people have a much higher mortality rate from cancer than white people do. They also include in the statistics for cancer all of the skin cancer patients, a condition which is rarely fatal. The numbers now will look much better to the public, who will continue to trust their doctor for their treatment and will continue to take all the drugs the doctor prescribes, which will make the sadistical pharmaceutical robber barons very happy and very rich. Yeah, the public does not realize how poor the outcomes are for cancer. They're much, much, much worse than is widely known by the public. Okay. For metastatic cancer. Metastatic cancer, the benefit of chemotherapy theoretically is a 5% increase in the 5-year survival, but they don't include, there's a tremendous amount of morbidity from side effects, and it depends on the cancer. There's some that do well theoretically, like testicular cancer, some of the lymphomas, but most of the solid tumors don't do well once they're metastatic with chemo. Okay. Now we're going to talk about something else, the germ theory versus the terrain theory. So Louis Pasteur lived from 1822 to 1895. The French scientist considered the father of germ theory, and that's the belief that many, if not most, diseases are caused by germs. Pasteur had said the germ is everything, the terrain or the milieu is nothing. And then his counterpart was Antoine Béchamp, who lived from 1816 to 1908. And he was also a French chemist and biologist, and he vehemently disagreed with Pasteur. Béchamp had said that milieu is everything and the germ is nothing. He believed that if a person's immune system is working properly because of the correct way that the person is living, eating, and handling stress, that the person will not be susceptible to disease. And this is called the germ theory versus the terrain theory debate of infectious disease. Okay. In fact, Béchamp believed that living entities in the blood called microzymes actually would become bacteria, viruses, or fungi in the body in response to host and environmental factors, specifically to clean up the mess of dead and dying tissues caused by the person from abusing their immune system by an improper way that they've been living, eating, and handling stress. Over time, Pasteur's theory became widely accepted, and Béchamp sank into obscurity. Béchamp's theory does not make any money for the medical industry, so it's no wonder that Béchamp sank into obscurity. Flies don't cause garbage. Instead, garbage attracts flies. This was Béchamp's astute, profound, and stunningly correct observation. Microzymes have been discovered by others since Béchamp, including Dr. Virginia Livingston Wheeler, a well-known San Diego physician, and Dr. Gaston Nassens, a Canadian scientist who called them somatids. Okay, well, that's pretty interesting, and there's some other things interesting about that. There was the old pathologist, infectious disease specialist, Rosenau. I made a book report about his book, and he did really fancy microbiology research with serial dilutions in his cultures, and he came to the conclusion that a bacteria can change its species. That the same bacteria, based on its environmental conditions, its pH gradient, for example, will grow in a different way, manifest in a different way, stain in a different way that'll get it labeled as a different type of bacteria. That's pretty interesting. He called that transmutation. Another thing people sometimes tell me, oh, well, aren't bacteria a cause of atherosclerosis? And I said, no, I don't think so. And they'll tell me, well, how come they often find bacteria with an atherosclerotic plaque? And what I'll say is, what do you grow bacteria on? It's a common thing to grow them on a blood agar plate. So what I think is happening is the bacteria are floating around in the blood and they can't do anything. They're in a dormant phase because there's no iron for them to multiply themselves. But if they find a blood clot in the wall of an artery with some of the cells opened up, there's going to be a lot of iron there. They can latch onto that in a parasitic form and then replicate themselves. So they're parasitic. They're just eating the dead tissue along the side of the wall made by a blood clot. And that's why Esselstyn could cure it with a low-fat vegan diet. Esselstyn didn't give anybody antibiotics. Okay, Dr. Day continues, what is the outcome of taking drug medications? The number one cause of falls in the elderly is the drugs prescribed to them by doctors. Yeah, so patients don't often understand that the goal of hypertension treatment is not to specifically lower your blood pressure. The goal is to reduce your risk of stroke, for example. Okay, so you don't want to just drop your pressure down to the same pressure you had when you were 18 years old, because that could be much too low to perfuse your brain. Why do you have a blood pressure? To pump blood to the top of your cerebral cortex against gravity. If you lower your pressure too much, you underperfuse your brain, then you're like the mouse equivalence of Delatorre's theory of vascular hypoperfusion as a cause of dementia, meaning if you don't get enough blood to your brain, you can become demented from that. You, of course, can pass out. Okay, the fall is called syncope. And so that's a very common reason these old people are falling, is because their blood pressure has been lowered too much by medication. Okay, Dr. Day continues. She says drug medications kill you slowly, and she mentions the 15 most popular drugs. And then I noticed when I looked at them more closely that, about a little bit over 1/3 of them are mitochondria inhibitors. Not good. And other ones are toxic to the brain in some other way, like alprazolam, Xanax. Okay, Dr. Day asks, what is the cure for cholesterol? She says it's simple and there are no side effects. The best way to lower your cholesterol is to stop eating it. There is no cholesterol in God's ideal diet, a vegan diet of fruits, grains, and vegetables, in their natural form, unchanged and unprocessed by man. Yeah, there's only cholesterol in animal foods. What is the cause of high blood pressure? The fat in animal products cause the blood to become thick and the red blood cells to stick to each other. With dehydration, the red blood cells become even thicker, and caffeine makes people more dehydrated. It also causes hyperlipidemia, which makes the blood more thick, increases blood viscosity. Stress also causes thickening of the blood and dehydration. It mobilizes lipids into the blood, and it also increases your voiding of your potassium, which you don't want, and your magnesium. The cure for hypertension is to eat a vegan diet of unprocessed foods and to drink adequate amounts of water, exercising regularly, getting adequate sunlight and sleep, and learning how to handle stress properly. Okay, so that's it for part 2 of this book review.